A path to predicting your likelihood of developing cancer may soon be on the way. Doctors and researchers from all over the world are in Philadelphia right now focused on finding a link between genetic testing and prostate cancer. The two-day invite-only symposium will allow the medical community to walk away with unique perspective on fighting this cancer in the future. Here to share his story, prostate cancer survivor, former NFL player Robin Cole, and to expand on this weekend's event, Dr. Gomella. Hi to both of you.
How are you?
Great.
This is a wonderful facility you guys have here.
Well, thank you for coming in.
I tell you what, Philadelphia is tremendous. I mean, I got here as quick as I possibly could from Southern California. I'm straight out of Compton.
Oh, and
I
then
got
you
here as soon as I could. Here I come to, you know, every time I come to Philadelphia, I say, why am I in Pittsburgh? Okay, this is
well, you wore the right jacket for the cold weather that we have here.
We're good and we're ready.
Tell me about your story of survival.
My story of survival is I was proactive. My father passed away at the age of 49 from prostate cancer. Little did we know in the beginning that the prostate cancer had already metastasized within his lungs before we knew about this prostate cancer. 1999, I have a brother. My first brother was diagnosed with prostate cancer in 2001. My second brother was diagnosed with prostate cancer in 2003. My youngest brother was 40. He was diagnosed with prostate cancer. And every time someone was diagnosed with prostate cancer, the percentages of me having prostate cancer continued to go up.
Right.
2004, my PSA rose 1 point. It went from 1 to 2. And I said, let's do a biopsy because of family history.
Proactive.
And because of that, I got it early enough. Everything's confined with prostate. Had it removed, and I'm still around.
And here you are.
A year or two later, started a foundation called the Obadiah Cole Foundation for Prostate Cancer.
Now, here's the question I have. Obviously, I think you already answered it. How hereditary is this? Because my father had it.
Well, that's when the doctors come in.
Yeah.
Very hereditary.
Yeah,
if your father's had, I don't know what age you are now.
35.
I'm
told that I need to go by the time I'm 40.
Yeah, maybe before that.
Wow, okay.
Dr. Gomella, you want to speak to that?
Yeah, so we're sponsoring Sidney Kimmel Cancer Center, and the Foundation for Breast and Prostate Health is sponsoring the first international consensus on the role of genetic testing for inherited prostate cancer risk like Mr. Cole has. We're trying to put all this information together. This field is rapidly evolving. We know a lot about breast cancer and ovarian cancer in women. We're just starting really now to get our hands around this issue of inherited risk of prostate cancer in men. And it's a new field. All the technology, all the latest breakthroughs are being brought forward so rapidly, we thought it was time to get everyone together, researchers, clinicians, genetic counselors, and put our arms around this to give advice not only to patients, but to their providers about how to best approach this.
And how cool that we're hosting it here in Philadelphia.
We're very happy to be here.
Great. Can you talk about some of the warning signs people should look out for? Of course, with Robin, he knew family history, so he just was proactive. Some people don't know what they're looking for.
Right. Well, actually, we don't like to find patients who have symptoms from prostate cancer. In its earliest and most curable stages, prostate cancer has no symptoms. Screening for prostate cancer when a patient has no symptoms right now is very controversial. So it's very important that a patient has a good dialogue with their provider as to are they the right one to undergo PSA testing.
Okay. And Robin, when you're the keynote speaker at this symposium.
Yes.
When you speak and share your story with people, what do you hope that they walk away with? What sense of something do you hope you leave with them?
You said sense of urgency is what I hope they walk away. But I'm speaking to doctors here. Okay, doctors, clinicians, the people that
are doing the research.
That are doing the research,
right.
and I want them to understand that sometimes we we move fast, and because of the mixed messages that have been coming out from committees over the years, you know, doctors are sometimes indecisive of do we move forward? How do we press forward? Do we check this person? I'm telling young men. They need to start getting checked earlier and a whole lot sooner. We say age. You know, there's an age there. You know, I say age 40. A lot of doctors believe age 40. You need a starting point. Okay. Some say age 50. Depends on if you have family history or not. I say you need a starting point. It would be just like anything else that you were starting. You need a starting point. You don't want to walk in the middle of it because then you don't know how long you may have been carried. Or as far as PSAs are concerned, which is a way of checking, you don't know where you've been over the last 5 years if you walk in and you have a PSA of 2, 3, or 4.
Dr. Gomella, talk to me about sometimes it's a struggle with getting men into a doctor's office. That's just the truth of the matter, right?
That's correct. Women are much more proactive in their health care than men are. But I think that if men understand really that this is the leading cancer in men, and one of the leading cancer killers in men, that we can find it early and treat it very effectively. Once the cancer spreads outside the prostate, our chances of curing the disease go down dramatically. We are making advances in that area, but right now, the best way to cure prostate cancer is find it early and treat it effectively.
Exactly what happened with my father.
Yes.
Well, that's amazing.
They got it right at the nick of time.
Good, good, good.
Yeah, it's not going to be a lot of warning signs in the beginning. That's why it's important that we get the information out. It's important that a guy like myself get the information out. Doctors have been talking about this for years, and a lot of times you have so many, like I shared with you, associations or committees that are out there pushing back, and the doctors say, no, 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 that's wrong. We have the studies that say we need to start checking this out a little sooner. We really need to begin to teach children, young men in high school,
That early,
on prostate cancer.
Yeah.
Okay.
Oh, yeah. I mean, my father passed when I was in college, but they need to begin to learn. A little different than our women. Our women begin to learn about themselves. They begin to learn about how to examine their breast when they're in middle school. We have men that are 40 years old and still have no idea. I mean, we don't have anybody. You can't examine yourself. We have no idea about what's going on, what's happening with that, and that it is a killer. We have 28 to 30,000 men dying every year, so that's kept secret in the world. We're kidding ourselves, only 47,000 men died in the Vietnam War in 20 years. Okay? This is very serious.
It is, and we appreciate you sharing your story and your
Thanks for having me.
And this is Philadelphia. It's Eagle country. It's not Steelers land, okay?
That's okay. Every once in a while you have to add some class.
I hear you. Former NFLer. Oh, look at you. Look at that.
Showing
Showing off the hardware. That's nice. All right.